there were a few other questions that came in, but I just want to start by opening up to all of you and welcome you and thank you. And what I do want to comment on what Richard was saying and I was saying, and I was laughing because I do love sometimes you need to advocate as a CBO. That's important. But I also think the other piece that we're really trying to figure out locally is that communication, even the communication to our stakeholders that, this is a long process. We're still figuring it out. We haven't forgotten. We're not there yet, I think is really important. So I want to reiterate that. Want to put it out for, yep, thanks, Jess. Yes, also at the end of the session, there will not be a return back to the main session. If you did not see that in the chat, this will be the end of the session. So I want to put out and see if there's any burning questions folks have at this point for us. If not, we can go to some of the ones we did not get to.
I do have a quick question. I hope you don't mind. My name's Molly Polis. I'm with Yolo County, and I'm the lead analyst. We're pulling our plan together and kind of organizing our structure. And I think one question or thought I had as we sort of move through the planning process or pulling our partners together, and this is more so related, I think, to pulling the CPP plan together. Really thinking critically and meaningfully about like drawing in partners into sort of certain components of the plan. It's sort of like you want everyone to participate, but you want their participation to be meaningful, and sort of having that understanding of when should you pull them into sort of like which components. And I know Ventura, you all have been quite ahead of the curve, and so I'm just curious sort of how you all sort of brought in people when, and kind of making that like a meaningful working group, right? Like actually working to pull items of the plan together, and sort of how you identified who should be pulled into sort of which pieces.
I can start, and I'll encourage others from Ventura. And Lori Clark is on here. I know she's here as a participant, but she has also been our guide and support. She's with the Social Policy Institute. If you don't, I think everyone knows Lori, but if you don't, from San Diego State, and has been working very, very closely with us on our wellness system work, with our ILT, and really has been instrumental in helping improve this work. So Laura, I want to invite you to jump in as well on the answers to this. And Molly, you threw me because you have a different hat on than in all the meetings I've been in with you. So when you said YOLO. Yeah, that is a good question. And I think that's something we've sort of outlined in even how we started our process with doing a lot of foundational work, even before getting to the CPP part of this and that element, to try to get bring all of our partners to the same place, collectively, starting at the leadership level and then the deputy level, and making this about wellness. And we've begun to now, we're focusing specifically on the comprehensive prevention plan. It really is, in a sense, with our wellness system, an example of a place where we're starting our collective work together. And initially, a lot of the work has been primarily behind, the detail work has been driven by child welfare so far. And as we're moving forward, we're starting to bring other partners together. Our prevention collaborative, we call it Essentials for Childhood. Ventura County we've done a lot of communication with them, and we're starting to engage them. For example, now in beginning what's called a social network analysis to get a sense of the level of partnership we have with community providers. They're helping us to reach out to them. So, seeing them as partners, the ICPM, that fits under 2083, but it also is very foundational to us in our CPP. That was developed in a very much put forward in a cross-system way through our wellness system, cross-system group, with the context or the thought that this is a foundational element to the work. So it's really, and part of it is also we're trying to be really clear on where do we want to be, what are the milestones to get to the plan, but also knowing this is the long haul. The plan is just really the starting point for all this, and rolling out and shifting the systems. We know this is going to be a multi-year process to get there. I mean, having Part 1 services even in place post-plan is probably going to be a year and a half to 2 years, just because we all know our county, for those county folks, the contracting processes and other things. So being clear with our milestones and where those milestones align with where to bring in different partners. And I'll stop there and see what any of the others from Ventura have to say.
So I'll just add a couple of thoughts. One of the things that I think Ventura has done very well that has helped to unify the public and private sector is interlocking agendas. So what gets talked about at the interagency leadership team also gets talked about and shared at the Wellness System Steering Committee and the Essentials for Childhood Collaborative and Strengthening Families Partnership. So for example, the fact that we're doing a social network analysis to take stock of where our collaboration is strong and we have something to build on and where we can do more. So everyone knows that we're doing that and has had a chance to weigh in and to also leverage needs that they've had for a survey or data collection. And that data is offered as open source for anyone of the public system or community partners to use as they see fit, as they're planning an agenda or what have you. So information sharing is really key, even though there may not be a lot of joint work already. The other thing that is very direct is using heat maps to identify target neighborhoods and then gathering the partners that are in that neighborhood to begin talking about what does a community prevention hub look like there. And so the dialogue by necessity involves the local partners, including parent and youth partners who are there as well.
Nicole, you had your hand up first.
I did. Yeah, I have a multi-part question. And so it's really kind of around diversity, equity, and inclusion efforts that you all have taken on in Ventura. I'd really love to hear about, what efforts you've made to include those with lived expertise in this process thus far, or what your thinking is in that area. And how are you reimbursing them? Are you reimbursing them for their time? Like, what does that look like? And then the other piece is, if you've done any kind of initial thinking about how you're going to track data related to disparity and disproportionality, and how the implementation of this plan might impact that down the road.
Definitely. And Jack, I would love you to talk about the parent leadership group and the connection. I think you have some of the technical answers as well around reimbursement and other things. And I can talk about data after that.
Yes, definitely. So I'm not sure if I'm sure you've seen the quilt, but basically the diversity is just the different lived experience is not limited to just, parents who are in the child welfare system. They're all included. And so our parents are paid for their time for any participation. I know that was one of the questions, and I'll just go over that right now. One of the questions was that what do we pay our parents? And we sort of have a three-part answer to that. So it's the flat rate for a parent who is a part of our core team sorry, not a flat rate. It's a $50 stipend for the participants who are parent core. But we do have coordinators who help, the planning of our core team. Those parents get sort of a monthly flat rate, depending on what they're doing. For an example, a parent might get $250 a month for, their participation. And then the third part to that is depending on what, again, what we call the meaningful engagement opportunities that they're involved in, that they're participating in, they would get, like say if it was a long day, or if it was, because they don't get paid per hour, they get paid per meaningful engagement opportunity. So they would get probably a larger stipend for something that was maybe like an all-day event, or depending on what the engagement was. And that is actually discussed upon and agreed upon before they agree to that. So that's my part to the answer. I don't know if you want to add to that, David or Salida. I know there was a data question in there, but
yeah, and Lori sort of actually kind of set the stage for the data piece. And talking about the hotspots, and I think we talked about this a bit in our presentation. And Salita, I think this was your part, but we are, as we look at diversity and equity, we're building on some of our work we have done previously that began to look across systems at certain neighborhoods where we might have disproportionate representation as well as disparate outcomes for certain populations. And I think we talked specifically about an area in the city of Oxnard, which is our largest city in our county, where from the child welfare standpoint, about half of our referrals and entries into our system historically in recent years had come from a 5 zip code area in South Oxnard. Similarly, similar kinds of outcomes and data across all of our other systems. So we intend to build on that data approach going forward, and we're in an interesting situation where we're also doing our county self-assessment right now and system improvement plans. We're going to be really leveraging those processes in this way as well. So we will be looking at hotspots of those areas to target where we have disproportionate outcomes across our system, and building on that as we go forward, both in our planning, but then as we measure impact, and from a planning process, wanting to very much reach out to those communities where we have those hotspots as part of the planning. You know, the communities know their communities best, and so that we're wanting to build on that. So I'll stop there and see if anybody else wants to add from Ventura.
I will just add that on a larger scale, looking at, you know, the DEI aspect of it and just data in general in Ventura County, we have a phenomenal resource. It's a website called healthmattersvc.org, and our public health epidemiologist has put that together with all kinds of really great data about things that impact the health and well-being of our community. And it's a very broad scope, and people can actually, it's open to the public, it's open to our partners, that they can go in and actually build a dashboard and look, are they looking at a specific age group? Are they looking at a specific zip code? Are they looking at, you know, a specific, you know, whatever that criteria might be? And so we encourage our community partners, the general public, and, you know, I mean, you know, students, interns, anybody to go in there and pull what they want, because it helps them to be able to advocate for their community too, and say, hey, this is really a problem right here. What can we do about it? And it helps get them engaged and looking at that data. So, you know, I think having a resource like that also is really critical, because it does point out the hot spots, not just for child welfare, but for, you know, our social determinants of health in general across the board, that people can look at what can we do in these areas for prevention.
Also want to put a plug in. I'm guessing Troy can talk about this better than I from or your strategies, or not Casey, sorry, but you probably know what this is. The opportunity community opportunity maps, I think is what they're called, are an excellent tool. If you Google that I think Casey is sponsoring, and we have used those as well. These are national, and you can drill down by neighborhood, by zip code, by city. And if you haven't seen those, I think they're really helpful, and they look across multiple determinants of well-being. So encourage that.
And David, I'll own being a part of Casey. Why not? You know, I'll take whatever job I can get.
There you go.
I have a quick question just before we move on from this. It's very interesting because I've been working, there are 4 counties that are really active that are on my caseload right now. And we've been working on this whole process of onboarding live expertise with a DEI focus, right? So everything we're just talking about is super interesting to me. So Jackie Flores Ortega, can I ask at a later date we get in contact so I can pick your brain, because I'm trying to find out from all of the folks that are doing this type of work what we're doing. Lori, I already know I can pick your brain, but I was wondering if really quickly, because I know we only got about 15 minutes left, could you tell me what the onboarding looked like of those lived expertise folks, and anything about retention, but that retention conversation might be at a later meeting when we get together.
Yes, definitely. I'd be happy to connect with you, Trey. So our onboard, we actually have a welcome packet that has been put together from our core team. We continue to sort of recruit, but again, like David said before, it's the making the connections with the different. I mean, it's really our organizations as well as, you know, referring parents to us. One of the things we also have is our quarterly social connections meetings. We also put it out there if they'd be interested in joining our core team. You know, what lived experiences do you have? What do you bring? I mean, really, I think every parent has lived experiences, but, you know, some are more, you know, open to sharing what their experience is and might want to be more involved. I think the stipend is a very big incentive for our parents to be involved and to join our core team. We're growing right now, but the onboarding process, again, would start with a welcome packet that we put together, just explaining what we do, what it is, you know, they would be participating in. We don't want any of our parents going into you know, a meeting not really understanding what's happening, what's going on, and so they would have to agree to join, you know, a committee or, you know, whatever it is that they're being asked to attend. We want them to feel comfortable. So a part of that packet is there is a piece in that packet where, you know, if somebody is requesting a parent with a certain lived experience, they would need to have a detailed explanation on what they would be expecting from that parent. So that's, I mean, that's just some of it. Again, we can connect later if you'd like more information. So
I definitely would, because we want to, over here at Strategies, kind of operationalize this at some level. Maybe not give people what they have to do, but give an array of suggestions of what we can do. Because we know this is a process. I've been using Junius Williams' tool a lot, so that we move from just informing folks, so we move to empowering folks. And we just want to have, I want to have a plethora of information to pass on to other counties. So anybody who's doing it, yeah, let's connect. You'll hear from me.
Great, thanks. And Regina, I know you've had your hand up for a few minutes. I want to get to you before we wrap.
Hey, good morning. Thank you, David. And I just have to say kudos for all your proactive data systems and your proactive ways for engaging those with lived experience. It sounds amazing. My questions are really around, you know, you caught me with the fact that you're already developing this concept of the wellness center. My question is really focused around whether you've engaged your different partners in those funding conversations yet, and what structure you're putting to that. If you think about all these different funding streams and the pragmatics of, hey, we need $1 million to open this center, how are you structuring those conversations to get to an end?
Shall you want me to start with that, or do you want to start with that one?
Yes, please, go ahead.
Okay, and know that we're early in this. I mean, this is, I mean, we're in for more context for anyone that's familiar with this. This is part of the behavioral health. That's what they call the BCHIP, Behavioral Health Community Improvement Program. These are bricks and mortar dollars that the state has put out for infrastructure development. So at this point, we as a county are going to be applying for essentially dollars to purchase a building. But to do that, we need to understand whether or not we can be able to sustain, you know, a level of services within that building, which is sort of our work we're doing on the side. In fact, we had a big meeting about that this afternoon about the fiscal piece of it. So we're beginning with understanding the behavioral health elements, and then starting to look at. So this is early. I mean, we are not very far along on this, but then we want to look at, for example, with First Five, which of those families, you know, what percentage of those families might be coming in that would be receiving support from First Five, which will be co-located in that center and potentially funded through First Five. There will probably be a percentage of families that are coming in either through the door of the Family Justice Center, which will be in half the building and also have other needs that the Wellness Center might support, but families that would be potentially eligible for the comprehensive prevention services, some of whom would be family first. So we anticipate potentially building this as part of our community pathway. And so we would have staff and they're trained to be doing those assessments and potentially then be able to leverage 4E as part of that assessment process of the community pathway. And we haven't even gotten to the point of talking about whether this may or may not include the delivery of evidence-based practices under 4E. And potentially there might be some under behavioral health that also would be those that are in the federal clearinghouse for FFPSA Part 1. And so these are all the pieces we're just beginning to try to put together. And it sort of came at us. We weren't thinking, oh, let's just jump into this right now because we're early in our comprehensive planning process, but it came about because of the opportunity with this behavioral health grant We thought, why do this in isolation? Let's look at this as an opportunity to test out our conversations and our work we've been doing around a wellness system. I don't know, Shelley, anything you want to add to that?
I would just add it's a real example of how all of this discussion and work and leadership opportunity has sort of infiltrated all of the different aspects of the way we're providing services throughout the county. And it seemed like a logical next leap, when again, we weren't looking for it, but it was, based on the needs assessment that Salita was, referencing, and the conversations with David, and looking at those, our 5 most, high risk community areas, and, what makes sense, looking to seek and serve the families that are most in need, and ways that we can do that in a more comprehensive manner. And so we dove right in, because that's what we needed to do at this point. So I think, to your point, is it Regina, really looking at our next step is, how do we braid all the funding, and how do we make something sustainable, especially when you're looking at this continuum infrastructure that's, there's a 30-year commitment to this, right? 30, I'm thinking 30 years, wow, and really looking at sustainability for that. So again, we'll have more of that discussion this afternoon, and it really is taking, cross-agency collaboration to really get it off the ground.
And honestly, it started with even being able to think in this way, because I know the very first conversations we had about this with our CEO's office, who's helping to be part of this, we had to really bring in that this is a cross system. And Cheryl, who's the lead on this, naturally is wired that way. But as we were talking to our other partners across the county, it was helping them to understand that this is the right way to do this. And even the Family Justice Center wasn't originally part of the conversations, but it's such a natural link, because that's already a cross-system model that's serving many families that would benefit from both programs. And I see a question about a super agency, or are we under the same umbrella? We actually are not I'm using the term super agency for those familiar with that. We are not a health and human services county. We do not have that structure. We just hang out a lot together. So
I think we're super agencies.
I would agree with that. I think we are a super agency. We just created our own.
It is interesting, because both public health and behavioral health are part of our larger healthcare agency, which we are a county with a county hospital system as well. So that includes our ambulatory care system and hospitals and others. So human services is separate from that. I spend probably more time in meetings with the folks on this call from Ventura than I do with many of the folks in child welfare.
Well, and I was going to say too, David, just even, she's asking a little bit about, just logistical data sharing challenges. Of course, yes, we have data sharing challenges being, even between behavioral health and public health, we're under the same HCA umbrella, but we still have challenges sharing data also. But, we have programs, for example, in public health that are funded by HSA, with our child welfare program, the staff live under public health, but are funded by Human Services Agency funds. So, we get a lot of that kind of coordination and collaboration too. Is it challenging? Of course it is, but we've been doing it for a long time, and continue to just refine the process over the years. And like David said, we spend a lot of time in meetings together. We forget we work for different agencies sometimes.
And we are trying to look at technical aspects, technical solutions to some of this data sharing. I mean, some of it has to do with legal interpretations of what can be shared or not shared. Some of it has to do with the technology. A lot of it has to do with engagement of families and releases of information. So we're trying to approach it from all of those standpoints. Public health, for example, has been leading the effort around a community information exchange system. And there's some really exciting work happening there that is inclusive of all of our agencies, but they're taking the lead on that. There's a partnership now that with behavioral health and child welfare around CAN's data sharing using a group called OPICA that has a tool that it's just emerging as a way to do that. From a legal standpoint, we have been fortunate in our county, at least between behavioral health and child welfare and probation, in that we have the interpretation by our county council has been fairly broad, and we have been able to pretty readily share information, at least on children that have been touched by child welfare, and that has had to do with interpretations by county council. I would also encourage, and we're still working through this, I would encourage you to have your council look at both the way the law AB2083 is written around data sharing, as well as another bill, AB2229. I think there's 3 2s in there, which in a sense is almost an umbrella for 2083. And we're exploring an interpretation by our council that is a pretty broad interpretation that would allow for data sharing across systems, across that continuum of wellness. I mean, officially, I think it's around, it uses the term child abuse prevention, but that can be looked at, risk factors can be looked at very broadly. And so we are working with our head county council and county council leads to explore that from a legal standpoint. So there's different tacks, I think, that we can take. And another element we want to really look at is building on what some other counties, I think there's a handful of other counties that have been successful in designing and putting in place universal releases of information, which we have struggled with locally. And so we're going to be looking at that as well.
David, I think we have 4 minutes left, and then participants will be excused. So I don't know if there's any other questions that anybody has. Looks like Nicole asked, well, I think you kind of addressed this a little bit. How are you handling child and family identifiers and sharing that information across multiple community partners? And we talked a little bit about that.
One of the things we've done, for example, when we did that broader data sharing that we talked about, is we were looking at data in the aggregate and using heat mapping, for example. I think there was a question about that last time as well. And so when we were showing data in hotspots, trying to be really careful about using data, using even visuals that are specific to address is where you could, because some communities are small and it'd be easy to figure it out, but using more of a hotspot kind of approach where you can see, there's clusters here that are maybe different colors or more intensity or other kinds of things to show that visual, just to protect the confidentiality of those families and those communities. Are there any other questions in the chat or any other questions anybody has? I know there was a couple that we will, some technical questions around the data that we'll get some answers for, and we'll make sure to include those in the written.
Hi, David. This is Liz Crudo from San Francisco. I was curious when you did the presentation last, at the last venue, you talked about the onboarding of the AB2083 group and the 3-day training. And I was really curious about that one, to hear more about it, what that included, how you funded it. Thanks.
Sure, I know, and we'd love that we can have definitely a longer conversation if you'd like, and probably bring Lori into that because she was instrumental in making that happen, and/or Richard. But we funded that through our, I think we're using the block grant funds, the prevention block grant funds. I mean, starting with that, and it really was a shared effort from a vision casting and understanding the intent of this by our ILT, starting with our ILT, but in embracing this and being a part of it, but then some more of the logistical parts with our next level, the deputy level, which we're calling the wellness steering team, which Cheryl Sleet and I all sit on, to help get that shared commitment to that process. And then there was a group, we're calling them tiger teams in our county, but a group that there's a lot of logistics to put that together, but in partnership across agencies to make that happen in terms of location, logistics, and all of that, but highly effective in engaging those across our respective agencies, particularly those that hadn't been as familiar with where we're going because of our own internal communication that was just beginning. And I mean, happy for any of us to talk more, Liz, if you'd like to.
Yeah, we may take you up on that.
Okay.
We have a meeting on Monday, so
there you go.
Let's check the interest. Thank you.
Yeah, just a really exciting opportunity. I think the layers, the integrated, the interlocking agendas is huge, and really getting the word out, and then seeing the layers of leadership participating in the training was just incredible and inspiring, because it really gets to the heart of why we do what we do and connecting all of the pieces. So it's just a great opportunity to really pull from all of the different agency partners. So I think if you're struggling with how do we get everybody on the same page, this is a wonderful forum for that.
Yeah.
I finally have a phrase for competing agendas so that I can combat that in interlocking agendas.
I love it. Lori can copyright it. I think the last thing is patience. This is hard work. This we keep using the word adaptive change, and Lori reminds us of this all the time. Yeah, this kind of system change is tough, but it's the reward is absolutely worth it. And we're just starting. I mean, we're happy with where we're at and excited, and it's got me invigorated in this field. But we're just getting going. So thank you, everybody. I think we are at 10:30, so appreciate it, and hope to see everybody on the 17th.